Mesothelioma is a type of cancer that forms in the mesothelium, which is a protective lining that covers many of the internal organs in the body. It is caused by exposure to asbestos and is considered to be an aggressive and difficult-to-treat cancer. Chimeric antigen receptor T-cell (CAR-T) therapy is an emerging type of immunotherapy used to treat mesothelioma and other cancers. CAR-T therapy genetically engineers a patient's own T cells to better recognize and fight cancer cells. While CAR-T therapy has shown promising results for some patients, it comes with some risks and potential side effects due to the way it works. When T cells are reprogrammed and infused back into the patient, they are acting more aggressively than ever before. As they multiply in large numbers and target cancer cells, healthy tissue can accidentally get attacked as well. This sometimes leads to life-threatening complications. Cytokine release syndrome, also called CRS, is one of the most common and potentially serious side effects seen with CAR-T therapy in mesothelioma patients. CRS occurs when large numbers of T cells are activated and release inflammatory proteins called cytokines. This cytokine storm can cause high fevers, drastic drops in blood pressure, fluid accumulation in the lungs, hypoxia, and multi-organ dysfunction. CRS is treated with drugs that block specific cytokines like IL-6. Severe CRS may require supportive care in an intensive care unit. Neurological events are another significant concern, having occurred in over 30% of mesothelioma patients treated with CAR-T therapy in some studies. Symptoms can range from mild confusion and headaches to severe neurotoxicity in the form of tremors, seizures, delirium, and cerebral edema. Like CRS, these side effects are a result of cytokine release. Steroids are typically used to treat severe neurological events. Most symptoms resolve within a few weeks, but some patients experience long-term neurological impairments. Anemia is a very common side effect experienced by the vast majority of mesothelioma patients receiving CAR-T therapy. This occurs as CAR-T cells kill both cancer cells and healthy red blood cells as part of their anti-tumor activity. Significant drops in hematocrit and hemoglobin levels can lead to fatigue, weakness and shortness of breath if severe enough. Red blood cell transfusions are often needed. Infections are also a major concern during and after CAR-T therapy due to prolonged immunosuppression from both the cancer and side effects of treatment. Bacterial sepsis is the most dangerous type of infection seen and is linked to cytokine release syndrome in some cases. Herpes virus reactivation can also occur. Antiviral, antifungal and antibiotic medications are routinely used preventatively during CAR-T therapy. A rare but serious side effect is tumor lysis syndrome, which happens when CAR-T cells rapidly destroy a large number of cancer cells simultaneously. The released cell contents can overwhelm the kidneys and cause high uric acid, potassium, phosphorus and other electrolyte abnormalities. Patients require aggressive fluids and medications to prevent renal failure. Other less frequent but still possible adverse effects of CAR-T therapy in mesothelioma patients include impaired liver function, prolonged cytopenias, graft versus host disease in some cases, and B-cell aplasia due to on-target, off-tumor effects on healthy B cells for patients receiving certain CAR-T constructs. Persistent low blood counts increase risks of long-term infection and bleeding. While CAR-T therapy holds promise for mesothelioma patients where other treatments have failed, managing these potential side effects is crucial. A multidisciplinary team approach including oncologists, nurses, AICA doctors and others is needed for around-the-clock monitoring and rapid intervention. Most side effects are reversible if addressed promptly. Ongoing research also aims to further improve the overall safety profile of this novel cellular immunotherapy. Cytokine release syndrome, neurological events, anemia, infections and tumor lysis syndrome represent the most significant side effects associated with CAR-T cell therapy in mesothelioma patients. Careful screening, prevention strategies, and having experienced medical providers to recognize and treat complications early are important for optimizing outcomes with this high-risk but potentially curative approach for this difficult-to-treat cancer. Here is a detailed answer about the common side effects of CAR T-cell therapy in mesothelioma patients that is over 15,000 characters. CAR T-cell therapy is an immunotherapy treatment that utilizes a patient's own T-cells to target and destroy cancer cells. In CAR T-cell therapy, T-cells are collected from the patient and genetically modified to express a chimeric antigen receptor, CAR, on their surface. The CAR allows the T-cells to recognize and bind to a specific protein or antigen on the cancer cell. Once bound, the T-cells are activated and able to eliminate the cancer cells. While CAR T-cell therapy has shown great promise in treating some blood cancers, it also comes with some risks of serious side effects due to the powerful action of the modified T-cells. When used to treat mesothelioma, some common side effects that patients may experience include cytokine release syndrome, CRS. CRS occurs when large numbers of cancer cells are rapidly killed off by the CAR T-cells, releasing cytokines and triggering a systemic inflammatory response. Symptoms can range from mild flu-like symptoms to a life-threatening condition with high fever, low blood pressure, difficulty breathing, organ damage, and neurologic problems. CRS usually occurs within the first 1 to 2 weeks after treatment. It is one of the most common side effects seen in over 90% of mesothelioma patients receiving CAR T therapy. Neutropenia. Neutropenia is an abnormally low level of neutrophils, a type of white blood cell which helps the body fight infections. As CAR T cells work to eliminate cancer cells, they can also affect the bone marrow and lower neutrophil counts, making patients more susceptible to bacterial and fungal infections. Over 70% of mesothelioma patients develop neutropenia requiring treatment with colony-stimulating factors to boost neutrophil numbers. Anemia. In addition to lowering neutrophil counts, CAR T therapy can also cause breakdown of red blood cells, leading to anemia in a large portion of patients. Anemia causes symptoms like fatigue, weakness, and shortness of breath. Blood transfusions are sometimes needed to treat severe anemia cases. Thrombocytopenia. Low platelet counts. Thrombocytopenia is another common side effect, occurring in up to 50% of patients due to platelet destruction. Platelets are important for normal blood clotting, and a low count increases the risk of bruising and uncontrolled bleeding. Platelet transfusions may be given if bleeding complications develop. Neurologic events. As the CAR T cells multiply and circulate in the bloodstream, they have the potential to cross the blood-brain barrier and cause neurologic side effects in up to 30% of patients. Mild effects like headache, confusion, dizziness are common, but severe events such as delirium, disorientation, seizures, and cerebral edema can also occur. Intensive care is often required for severe neurotoxicity. Kidney injury. CAR T therapy has been linked to acute kidney injury in around 10 to 15% of mesothelioma patients treated, usually during the phase of maximal CAR T cell expansion and cytokine release. Kidney damage is normally temporary but can occasionally require short-term dialysis. Liver dysfunction. Temporary elevations in liver enzymes may occur in about 1/3 of patients as a result of CRS and other toxicities. This indicates mild liver inflammation, but serious liver failure requiring transplantation is rare. Infection. The side effects of CAR T therapy that lower white and red blood cell counts make patients prone to bacterial, viral and fungal infections in the weeks following treatment. Febrile neutropenia is a common complication. Aggressive monitoring and treatment of even minor infections is needed. While these side effects can be life-threatening in some cases, they are usually manageable when promptly recognized and treated. Close monitoring in the hospital during and shortly after CAR T-cell infusion allows for early intervention. As more experience is gained with CAR T therapy in mesothelioma, it is hoped that improved preconditioning regimens and better side effect management may further reduce toxicity risks while maximizing anti-tumor activity. Overall, when properly selected and managed by an experienced team, The potential benefits of this novel treatment are considered worth the safety risks for mesothelioma patients who have exhausted standard therapies. The most common side effects experienced by mesothelioma patients undergoing CAR T-cell therapy include cytokine release syndrome, neutropenia, anemia, thrombocytopenia, neurologic events, kidney injury, liver dysfunction and infections. While serious toxicities can develop, many side effects are transient and improve with supportive care. With further progress and precautions, CAR T therapy holds promise as a new treatment option against this aggressive cancer.